In this video, I wanted to show you what kind of things to look for when you're checking your horse's back for pain. In this mare, she has pretty significant pain in her lumbar area. It's on both sides, but she displays a little bit more painful on the right side than on the left. I usually start off lightly and then I'll increase the amount of pressure I put to see what level of pain they're in. And as you can see, she's fairly uncomfortable with light to moderate palpating of her back. So looking from behind, straight down the horse's spine, you can check for little curves in the spine to give you a clue of what's going on and if there's a problem there. This particular horse, there's a slight pull on the spine to the right. It's a little bit hard to see in the other picture, but I took a side by side for you and drew a little line to kind of show you what I was looking at when I was checking her. Some of her other symptoms were, besides the painful back, she's very stiff in the hind end. She doesn't track up. She short strides on the left hind, has a hard time maintaining the circle to the right, and she drags her toes. This is another example of a horse that palpated painful in their lower lumbar area, and this horse was sore in the left side of the low back, and as you can see, they have a very, very long back, which already predisposes them to have back problems. And they have the beginnings of a roached back and also starting to show signs of a hunter's bump. You can also see a lot of muscle wasting on the top line and a really, really flat croup. When this horse walks, it's very, very stiff, particularly on the right hind. Has a hard time tracking up with the right hind. So with these two examples, you can get an idea of how the lumbar pain that your horse is experiencing can be sourced back to the back end. And in particular, in these two cases, when they are sore on one side of the low back, it usually translates to the opposite hind leg or hind end, whether that be in the pelvis or somewhere else lower down in the leg or foot. It can really be a very complex issue to try and figure out what's going on, which is why it is so important to enlist the help of your veterinarian or your equine body worker or chiropractor, and even your hoof care professional to help you figure out where these things are coming from.